Hello and welcome to this video. Meghan Markle is due to give birth any minute now, and fans think she might be having a C-section birth due to her older age. According to medical professionals, geriatric mums typically aged over 35 are more likely to need a caesarean, but there can be complications. Royal fans have been on tenterhooks for any news on the Duchess of Sussex, 37, and her baby, and have taken to Twitter to speculate on how she will deliver. One fan said, "Not that 37 is old, but I'm beginning to wonder if Meghan is scheduled for a C-section." And another added, "Meghan is having a C-section. That's why we aren't hearing a word, and it's gone into lockdown." Sun doctor Carol Cooper told Fabulous Digital that it is more likely Meghan will have opted for a caesarean birth. Dr. Cooper said, "As far as the labour goes, she is only 37, and if you are in your mid-30s and you are eating healthily, exercising regularly, and you are fit and are the right weight as she seems to be, there is no reason why she should have significantly more complications than a younger woman. But statistically, there are higher risks, like higher blood pressure, preeclampsia, diabetes of pregnancy called gestation diabetes. She is more likely to have a premature baby and a slightly higher risk of a stillbirth. There are also possible chromosome conditions that she is more likely to get." Dr. Cooper also advised that geriatric mums like Meghan are more likely to have labour-induced or have an assisted delivery, including caesarean. She explained, "This is because the birth complications are more likely. There is a longer labour and possibly more bleeding, and therefore the risk of your baby getting more stressed. You are more likely to need a caesarean." Dr. Cooper advised that doctors are typically wary of letting geriatric mums go over their due dates and will often suggest an induction. She said, "They are likely to induce at 41 weeks, but celebrities often get induced for other reasons. Perhaps doctors might be slightly more cautious in going over the due date, but 37 isn't that old anymore. The placenta doesn't work as well after the due date, therefore the baby is at risk of not thriving. Geriatric mums may be more likely to need a C-section birth, but they are also more likely to experience C-section complications. A recent study in the Canadian Medical Association Journal found that geriatric mums who give birth by caesarean are 3 times more likely to experience severe medical issues. These include hemorrhaging after childbirth, and the problems aren't just limited to older mums. It was also found younger mums were 1.5 times more likely to have problems after a C-section than with vaginal births. NHS guidelines state that expectant mums are entitled to request a caesarean if they do not wish to have a natural birth. Although the risk may be higher, C-section mums typically avoid other effects of vaginal labour, such as urinary incontinence. Thank you for watching this video. For the latest in celebrity news, please subscribe to my channel.